A new at-home spit test appears to be as effective as birth control pills at preventing pregnancy, and it's ready for use in Europe. Would you use it to avoid taking hormones? I'm Dr. Renee. I'm a practicing doctor, a medical writer and a broadcaster. The British Standards Institution this month certified a new device from Innes Minilab that predicts fertility, and it can now be sold as a contraceptive device as well as a fertility tracker. This is not a new test. It's been available for years as a fertility monitoring tool designed to help boost people's chances of pregnancy. It works differently to other fertility tests. This one tracks users' progesterone, which starts to rise just before ovulation. This test measures progesterone daily as it changes in saliva. Now, Minilab can also be used to prevent pregnancy rather than help achieve it. A small study showed that the device was 92% effective, which is about the same as the hormonal birth control pill, but it doesn't have any side effects. This new spit test is the first reliable progesterone test on the market, and it will be rolled out in Europe in September, and after this in the UK. There are other types of apps which rely on temperature to track hormonal levels and other bodily changes. There are lots of things that can interfere with temperature, and these are not as accurate as hormonal pills. But a saliva test for progesterone may be a game changer, working on hardcore biological data. Blood tests are gold standard for hormone tracking, but saliva offers a promising alternative that's cheaper, faster, and done very easily at home. So how is it used? Well, at the same time, every day you spit into a test strip and insert it into a small device that then measures your progesterone. The result feeds back into an app, which takes a few months of time to understand your unique hormonal fluctuations, but that's because we are all unique. But once it actually knows you, it can then identify your fertile window by predicting approximately 6 days a month when you are most likely to get pregnant. You would then abstain from sex during these 6 days or use another barrier contraception such as a condom. The study was small. There is no doubt it was also observational, and it's not yet been peer reviewed, but it looked at more than 200 women in Germany who used the Minilab for 6 months. They were advised not to have unprotected sex on the days that the app said they were fertile, and they were asked to record their sexual activity. 11 got pregnant, but 2 were excluded for not following the rules. And the manufacturers said, "We did not have a case where our system gave the wrong ovulation day or the wrong fertile days." The findings translate to an effectiveness of 92%. So if 100 women use Minilab as a contraceptive for a year, 8 would potentially fall pregnant. And that is about the same as the contraceptive pill or patch, and it's more effective than condoms, where 12 would get pregnant. 18, my fault. But less effective than the non-hormonal coils, which are more than 99%. I like this. It's another way of being in control and not taking hormones, which I never got along with. But as with all contraception, you have to follow it to the letter. It's as good as you are at using it.